हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन की इंडोक्राइनोलॉजी सेक्शन के सम इंपॉर्टेंट एमसीक्यू। A 24-year-old man present to a physician for a normal routine checkup. He wants to get his sugar level checked because sometimes he experiences fatigue and thirst, but very mildly. He has had a family history of diabetes for successive last two generations. The physician finds a high blood glucose level as fasting blood sugar is 225 mg per dl. There are no other classical symptoms of diabetes. Hence, he suspects a case of maturity onset diabetes in a young. Which of the following statement regarding maturity onset diabetes in young body is incorrect? The most common type of mood is type 3 is the correct. HNF first alpha gene is involved in the pathogenesis mode, correct. Treatment is initiated with glimepiride, correct. Pancreatic beta cell mass is reduced, wrong. The answer. Because the maturity onset diabetes of young mode is autosomal dominant, affecting individuals age less than 25. The insulin secretion is decreased even through beta cells are normal in amount. In moody type, the beta cells is normal, but HFN1 alpha gene mutations cause beta cell dysfunctioning by altering glucose metabolism in beta cells, thus leading to impaired glucose induced secretion of insulin. Next question. A patient underwent screening and the results show fasting blood glucose levels are 250 mg per cent. The ratio immune assay of insulin is normal. What is the likely diagnosis? The maturity onset diabetes of young years is the diagnosis of the radioimmune assay insulin is if normal. Modi present impaired blood glucose levels induced by the diminished insulin release due to a autosomal dominant inheritance pattern. The I already told the onset of Modi is 25 years or younger. The beta cells mass is normal, but decreased insulin secretion occurs. It involves mutation in the nuclear transcription factors genes, most commonly hepatic nuclear factor 1 alpha. Nuclear factor 1 alpha. Alpha that regulates the islet gene expression. Patients are responsible of sulfonylurea which cause increasing insulin secretion. Next question. A 42-year-old man comes to the physician with complaints of frequent urination, fatigue and excessive thirst. His blood sugar level is checked which is 121 mg/dl. The physician prescribes him an oral glucose tolerance test. All of the following conditions show a false positive oral glucose tolerance test except malnourished infection, severe emotional stress, exercise. Here the option is the option D, exercise, because it does not give false positive oral glucose tolerance test because during exercise the muscle will consume more glucose, hence blood sugar levels can be normal in a diabetic patient. Exercise also enhance insulin action and carbohydrates tolerance for between 24 to 72 hours. Between 24 to 72 hours. Next question. A 38-year-old man present to a physician with a family history of diabetes mellitus with the complaints of frequent urination, excessive thirst and weight loss. He also complained of fatigue and blurred vision. The physician prescribed him the drug Amaryl. It contains glimepiride, which is second generation sulfonylurea. Which of the following statement regarding sulfonylureas is incorrect? Sulfonylurea is incorrect. Sulfonylureas act as receptor in pancreatic beta cells, resulting in the closure of sodium channels. The incorrect option. Because the primary mechanism of action of sulfonylurea is to bind to the sulfonylureas receptor on pancreatic beta cells and causes to closure of the ATP sensitive potassium channels, not sodium channels. Causes the potassium channel, not sodium channel. Causes the potassium channels. Thus, the initiating a cascade of event, the causes of the release of insulin. Here the answer. Next question. Which of the following condition is associated with an old male with long-standing diabetes mellitus, dysuria, Fmge, glucose level of 200 mg/dl, blood pressure of 160/92, urine albumin of 35 mg and laboratory result including urea, creatinine and uric acid levels. Urine Neet-Pg can easily detect macroalbuminuria. 24 hours urine albumin is more sensitive than a spot sample urine albumin, and microalbuminuria correlates with nocturnal spike in systolic blood pressure. Is the right answer. Whether the patient presents with the clinical features of diabetic nephropathy here. Diabetic nephropathy is a microvascular complication of diabetes mellitus. Diabetes nephropathy is initially manifested as microalbuminuria. Microalbuminuria is the urinary albumin excretion of 30 to 300 mg per day. Microalbuminuria correlates with the nocturnal spikes in systolic blood pressure. There is a positive link between the high blood pressure and the macroalbuminuria. High blood pressure may cause macroalbuminuria by increasing glomerular filtration pressure and subsequently causes kidney damage. Antihypertensive activity decreases the macroalbuminuria by decreasing interglomerular pressure and lowering systemic hypertension. Hence, the normosensitive diabetic patient with the macroalbuminuria have the slightly elevated blood pressure during sleep, which is lowered by the antihypertensive therapy. The next question. A patient having type 2 diabetes mellitus is diagnosed with a urinary tract infection. Which of the following anti-diabetic drug is contraindicated in this patient? Gliflozin, voglaflozin, thiazolidines, elbiglutide. The option is the gliflozin, because the gliflozin is a sodium glucose co-transporter of SGLT2 inhibitor. SGLT2 inhibitor. It decreases the urinary loss of the sugar by inhibiting SGLT2 in the proximal convoluted tubules in the kidney. They inhibit glucose reabsorption, lower the renal threshold for glucose, and lead to increased glucose excretion. Due to the increased urinary glucose, they promote the development of urinary tract infection. And this drug do not cause hypoglycemia. Loss of glucose may promote modest weight loss. Next question. A 43-year-old male is brought to the emergency department by the paramedics after sustaining a road traffic accident 20 minutes ago. He is unconscious and bleeding from the scalp is seen. The medication card in his pocket reveals that he is a known diabetic and uses glimepiride and metformin. Which of the following is the next best step in managing the patient? Blood test, intravenous glucose and CT scan, saline solution of CT scan of the head, distose solution in the CT scan of the head, secure airway, rule out hypoglycemia, perform CT scan of the head. Here the answer is the secure airway, rule out the hypoglycemia and perform a CT scan of the head. Is the answer, because the any patient presenting after trauma should be managed based on the following, like the airway, breathing, circulating, disability, exposure. Similar, the first step of the patient is to secure the airway. Then breathing and circulatory changes should be managed. In the case of unconscious diabetic patient, hypoglycemia or hyperglycemia should ruled out before starting the treatment. Once hypoglycemia is established, appropriate fluid management should be done to stabilize the patient. After that, a head CT scan should be done to rule out intracranial bleeding. Thank you and keep revising.